Alrighty. So welcome to BRHP's COVID-19 vaccine info session. Again, thanks for making time out of your schedule to join us. I am Deidra Crutchfield, the Executive Director of the Baltimore Regional Housing Partnership. We decided to host this information session because we know that many of you still have lots of questions about the COVID-19 vaccines and vaccination process, and we wanted to do our part to make information more accessible to our community. As the saying goes, knowledge is power, and when you are informed, you are able to confidently make decisions. Before we get started, please note that the event is being recorded. Today's session will be a roundtable discussion, and we will also be taking questions from the audience who are viewing via Zoom. So you may submit questions throughout this conversation in the chat box, and we will do our best to answer all of them. BRHP is thankful to have a variety of expertise on our board of directors, and one such health expert is our board member, Dr. Rachel Thornton. Dr. Thornton is an associate professor at Johns Hopkins School of Medicine and executive director for clinical services for Johns Hopkins Medicine Office of Population Health, where she oversees the design and execution of models of care and deployment of clinical resources to optimize population health management and support community health. She has extensive expertise in cross-sector collaboration and continues to practice primary care pediatrics. She's an expert in health equity and health disparities research and the impacts of non-health sector policies on child health and family well-being. So I'd like to take a few minutes to turn it over to Dr. Thornton to provide some opening remarks.
Thank you, Deidra. As is always the case when someone reads your bio out loud, it's a little embarrassing, but it's really an honor and a privilege to be a new member of the board of directors of BRHP, and I have so much admiration and appreciation for Deidre's leadership and for the work and leadership and dedication of the entire BRHP team. And I'm also really grateful to have such wonderful colleagues at Hopkins who are willing to give of their expertise and time to this important conversation that I hope will be interactive and an honest conversation where people feel comfortable and empowered to ask the real questions that you have and lean on the expertise that's here. To answer those questions for you. So I look forward to the conversation and again, really applaud BRHP for taking this proactive step to empower its clients and staff and community with information.
Thank you so much for those remarks. We are also pleased to welcome Dr. Deidra Cruz and Dr. Corinne Keet. Dr. Cruz is a professor of medicine in the Division of Nephrology at the Johns Hopkins University School of Medicine. She holds faculty appointments with the School of Nursing, the Welch Center for Prevention, Epidemiology, and Clinical Research, the Center on Aging and Health, and the Center for Health Equity, where she is Associate Director for Research Development. Her research program aims to advance equity in kidney disease and hypertension outcomes by focusing on social drivers of health inequities. We've had the pleasure of working with Dr. Keet for several years, planning a health equity grant initiative, as well as BRHP's mobility asthma project. Dr. Keet is an associate professor of pediatrics at the Johns Hopkins University School of Medicine, a specialist in treating pediatric allergic diseases. Dr. Keet has a particular focus on food allergies. She is active in conducting clinical, epidemiologic, and translational research into the prevention and treatment of food allergies. Dr. Keet is an NIH-supported principal investigator of several studies. So thank you to all of our doctors that are joining us today for sharing your time and insight. Before we get to the roundtable discussion, we wanted to have one of BRHP's staff members who has recently received the vaccine to share a little bit of her experience with you all to provide context for the discussion. So I would like to welcome my colleague, Letitia James, one of our customer care representatives, to share a little bit about her experience. Tish, I'll turn it over to you.
Hi, everyone. I just want to give a little bit of my experience with the vaccine. I want to start off first with what motivated me. Currently, I have a health condition that puts me at high risk. So that was a big deciding factor. Also, I have a terminally ill mother that I care for, and it could be really detrimental to her if I didn't get the vaccine. So that was the biggest deciding factor of me getting it. Um, the process with the appointment was fairly easy. I simply Googled in my area where I could receive the vaccine. I settled on the Baltimore City Convention Center. Um, they had some questionnaires that I could complete, and it went really fairly quickly. I had to answer a few questions, give my personal information, some contact information, and submit. Um, After that, though, kind of got a little sticky because if I hadn't been checking my spam, I kind of would have missed my appointment. But once I verified my email address, I was able to get an appointment that same day. So it went fairly easy. Um, I did have some symptoms with the vaccine. I would say I had some dry mouth. I had headaches for a few days. They were only slight. I wouldn't say I had any migraines or anything like that. And the injection site, I would say I was sore, like really sore for about 3 days. But other than that, I think everything went really well.
Awesome. I really appreciate you sharing that personal story about your experience. So now we're going to shift to just, again, a little roundtable discussion with our experts here. Additionally, if you have any questions throughout the conversation, we'd ask that you drop them into the chat, and we will pause to answer as many of those as we can. I'd like to start with Dr. Thornton. Tell us, is the vaccine safe? How does it protect against the virus?
Well, I can say that what I know of the evidence and of the information from the trials on the vaccines that are approved under emergency use authorization in the United States is that they are safe, and they have been tested on many tens of thousands of people even before the process of becoming available to the public after the emergency authorization permissions from the Federal Drug Administration, the FDA. I have a simplistic view of how it works. So I'm looking at my colleagues here, an immunologist and a nephrologist who I think could give a more technical definition, and I'll trust that they'll correct me if I get any of the important details here wrong. But I had the pleasure of my 8-year-old, after watching something on his virtual school platform, explaining to me his understanding of how vaccines work. And I thought, as a general set of principles, it was pretty close to spot on, with a few modifications. I'll say that so in general, vaccines work by precipitating your body to have a response to some component of the, in this case, virus, an immune response, so that in the future, if your body is faced with the real thing, it's already sort of programmed to respond effectively to fight the virus with antibodies. So my son's description of this was, well, you put a little bit of the virus into you, and that causes your body to have a response. And in the case of this vaccine, my understanding is it is not technically part of the virus, but it is genetic information that allows your body to produce a protein that is visible on the surface of the virus, and then your body produces an antibody reaction to that, so that if in the future, after you're fully vaccinated, you were to come into contact with the real thing, the SARS-CoV-2 virus, your body would already be in a good position to know what antibodies it needs to activate to fight the virus off effectively. But I'll stop there and just request that my colleagues who have kind of more technical expertise in this area than I do could correct anything I said that is not consistent with the truth. around this particular virus, this particular vaccine, excuse me, which to be clear is not a form of the virus itself. It's a RNA, it's genetic material.
Yeah, I don't have anything to correct. And hopefully you can hear me. I'm sorry, I'm in the car. But I think there's a lot of there's a lot of different kinds of vaccines for different kinds of viruses. The first viruses were just like that weakened viruses, that were not the real disease, but a weakened form or a similar virus. And then most vaccines that children get nowadays are virus, but sort of killed off, or so we call those inactivated. And these are a different type where they're getting your body to make the proteins yourself, which has sort of, for very technical reasons, makes it a lot easier for them and a lot quicker for them to do it, versus like our flu shots usually take a year because you have to grow them in eggs and the things like that. But the same principle, just exactly like Dr. Thornton said, of having trained your immune system.
Dr. Keet, we're losing you just a little bit. I'm going to pitch our second question either to Dr. Thornton or Dr. Cruz. And thank you for that very simplistic definition, which I totally appreciate, an 8-year-old's perspective, because there's so much to parse through. So I think that's very helpful. But is one vaccine better than another? So for instance, we know there's the Moderna vaccine, the Pfizer vaccine, a Johnson & Johnson vaccine. We've heard of an AstraZeneca vaccine. Could either of you speak to one being better than the other, or any differences between those?
I would love to hear Dr. Cruz's opinion on this, but I would say at this stage, whatever vaccine is available the day that you go for your appointment is the best vaccine for you on that day. And from an effectiveness standpoint, I don't know, maybe Dr. Cruz, you have something to say about that.
Yeah, I would agree. I think that they are very similar in terms of how good they are at, particularly at preventing people from getting really sick from COVID-19 infection, and I think most importantly from dying from the infection. And so, like Dr. Thornton said, the recommendation would be whatever one is available that you can get the soonest would be it would be recommended that you take that one. They are different in that, for both the Pfizer and the Moderna vaccines, they do require 2 doses in order to get to the level of protection against the virus that was kind of the level that was desired, by the team that tested them, as compared to the Johnson & Johnson or the J&J vaccine, which does just require 1 dose. But really across the board, they are quite similar in terms of what they are able to do in terms of protection against the virus itself. And so I would say there really is no one that is so superior over another.
A follow-up, Dr. Cruz. Are the side effects different depending on which vaccine you get?
Yeah, so the side effects are actually also pretty similar. There have been, I think, around thinking about side effects, the types of side effects that are most commonly reported are the ones, so if we think about the 2 vaccines that require 2 doses, so after that first dose, I would say many people will have some pain at the site of the injection, maybe even a little bit of swelling at the site of the injection. Usually that only lasts for a few days for those people that do develop that. Then after the second dose is where, for those that require 2 doses, is where there have been more reports of symptoms, where some people may have more body aches, they may have fever, chills. But again, usually those types of symptoms only last for a couple of days for those people that experience it as well. With the J&J vaccine, and I don't know if my colleagues have read different things about it, but because it is just a single dose, the symptoms, at least that have been reported so far, mirror more so that first dose type of symptoms that we've heard about for the Pfizer and the Moderna vaccine. But really across the board, for all 3 of them, those are the types that are primarily reported. The injection site, pain, maybe a bit of swelling, and for some people, some fever, some fatigue as well. Sort of feeling tired after the vaccine is another a common one, particularly after that second dose for those that are getting the two vaccines that one of the two vaccines that requires a second dose.
Thanks for explaining some of those side effects. Could you perhaps also speak to what the recommendation is for people who are pregnant?
Yeah, I can touch on that. So there are lots of pregnant women who have received the vaccine, including a number of pregnant physicians. I will note, and there was a recent study that just came out just within the last couple of weeks, actually, from some researchers at Harvard that actually did look at the amount of antibodies that were produced by pregnant women and also breastfeeding women. And they actually found that they responded very well to the vaccine. So meaning that those women did make good amounts of antibody, and that they that antibody was also present in breast milk. And so the thought is that that can actually give protection to their infants, their babies who are being breastfed. And so generally speaking, it's being recommended that pregnant women consider getting the vaccine. Of course, pregnancy is a time that certainly where women should be followed very closely by their physician, their obstetrician. And so certainly would be worth having a discussion with them regarding that. But at least what's coming out in terms of the research on it, it certainly suggests that it would be recommended for women who are pregnant to get vaccinated.
Thank you. I want to acknowledge that we've got a number of questions in the chat. Before I turn to those questions, and please keep sending them, I wanted to turn to Dr. Keet. For those who might be on the fence about getting a vaccine, can you talk about some of the long-term effects of the virus?
Yeah, I actually have had a number of colleagues who've had virus and I'm sorry, are you able to hear me?
Yes, that's
okay.
clear now. Thank you.
Okay. And they had relatively mild initial cases and have had very significant ongoing symptoms. I think that the rate of ongoing symptoms, it's a little hard, but it may be some studies up to 20% of people, like 1 in 5, who have symptoms like fatigue, neurologic symptoms.
You're breaking up again, having a little bit of technical difficulties. We missed a little bit of that.
I'm so sorry. I was just saying that it is common to have long-term symptoms with COVID, and some of those can be very debilitating. I'm talking about the infection, not the vaccine.
Yes, thank you for clarifying that. Dr. Cruz, could you speak to where folks can get the vaccine, and maybe a little bit about the priority groups?
Yeah, so there are certainly, we have priority groups that have been set by the CDC, the Centers for Disease Control and Prevention, but the states actually then can sort of decide where they, how they want to sort of roll out those different priority groups. In the state of Maryland, we have gone through groups 1A, 1B, 1C, and are now in group 2A. And so, and there actually was just an announcement I was just reading today that soon there will be that people who are 60 years and older will be eligible for the vaccine. This is again in the state. There are so many people who are eligible. Anyone really right now in the state of Maryland, just about who has any type of does any sort of work where they are public facing. So that includes certainly anyone working in healthcare, those who work in the in education are eligible. People who are members of the clergy or who have leadership roles in churches are eligible. So there's lots of eligible people who work in food services are eligible. And so there really are lots of eligible groups currently. As far as where, there are more and more places that are kind of being stood up. I appreciated Ms. James sharing her story and how she was able to access the vaccine at the convention center. Some local pharmacies are also providing vaccinations. Depending upon where people receive their health care, they can also access it. So at Johns Hopkins now, some patients are able to actually get it if they are receiving their care at Hopkins. And then there are some kind of large vaccination sites, including like the convention center, the Six Flags was doing vaccination. So there are a number of different places. I am a kidney physician, as was said earlier. I'm a nephrologist, and just in this past week, it was authorized for vaccinations to be able to be done at dialysis facilities. So for those, who may have a family member or who themselves may be being treated with dialysis, that's another really important opportunity now. I was really excited this morning that my patients were getting their vaccinations today, really for the first day, now that we have those doses available at our actual dialysis unit. So there's many places where the vaccines can be accessed.
Thank you.
And
Go ahead.
I think I just chatted in the One Stop website for the state and was just checking it today as to who is eligible. So you can go there to pre-register, and they also have a hyperlink there where you can see what the current eligibility categories are. And just like Dr. Keet had typed in, they're now eligible of up to phase 2B. And 2B is quite broad. It includes any Marylanders ages 16 years of age or older with underlying conditions that increase their risk for severe COVID-19 disease, any Marylanders who are 16 years of age or older with disabilities who are receiving SSI, SSDI, Maryland Medicaid, EID individuals, Maryland Medicaid RIM recipients, Marylanders receiving TDAP benefits, anyone receiving long-term services or supports. So it's quite a long list, a broad list of people who today became eligible.
We're having some more technical difficulties, but I thank you for sharing a little bit about where folks can go to find out where to get the vaccine. Additionally, just so our audience knows, we will be providing you with a resource list, and this recording will be made available as well on our website, so you will have easy access to all of this information. I want to turn now to some of the audience specific questions. Could anyone speak to the safety? And I think we talked about this just a little bit up top, but speak to the safety of the messenger RNA vaccine and whether or not they cause autoimmune diseases. There may have been some initial reporting out there regarding some of the early phases of the trials. And so could any of you perhaps speak to that?
I don't know if she's frozen, but I definitely want Dr. Keet to have a chance to talk about that. Definitely the autoimmunity part. In terms of the safety, maybe I can kick off that piece of it. I think one thing to really understand about these messenger RNA vaccines is that while it may seem like they kind of are new to us, in the setting of this pandemic, the technology surrounding it has actually been in development for about a decade. I mean, so that included in some work that was being done to look at some other viruses like the Zika virus, which you all may have heard a bit about some years ago, that were particularly affecting pregnant women, particularly in South America. They were also examined for the Ebola virus as well. And so some of that technology was certainly already under development, which allowed for the kind of expeditious adoption, really, of that, to sort of look at it for this particular virus, right? And so in terms of the safety, I think some important things that I know Dr. Thornton kind of outlined nicely how the messenger RNA vaccines work. One thing to know is while they include this kind of like a code that tells your body to make this little piece of a thing that kind of looks like a little piece of the COVID virus itself, so that then your body can develop a response to that little piece, and then that little piece kind of gets discarded. Actually, it doesn't sort of stay in your body. these types of vaccines don't impact the DNA of your cells. They don't actually get into the part of your cell that controls your DNA or makes changes to your DNA. And so in general, again, are really thought to be quite safe, and that's been borne out in terms of what's been seen from the clinical trials that have been done. I know there are a lot of questions about this autoimmunity issue, and I think Dr. Keet is now, her audio might be working, so I'm going to turn to her in terms of what she's heard about and what she knows about the autoimmunity question.
Yeah, let me know immediately if it's not working, the audio. But, all vaccines have a risk of autoimmune disease. They're very small for all of the vaccines we have. It doesn't appear that these have a higher risk that we know of so far than the other vaccines that we have. And it's also important to realize that viruses themselves also trigger autoimmune diseases. And that risk is probably higher than for the vaccines themselves. So there's not a contraindication to getting the vaccines if you've had an autoimmune disease in the past.
And could you just mention, what does contraindication mean?
Yeah, no, sorry. That means there's not a reason not to get it. As those are sort of right now, the reason not to get it would be had a bad reaction to another vaccine. Then you should see an allergist. Not if you're okay if you've had anaphylaxis to a food or something else, but if you've had an anaphylaxis to another vaccine, you should talk to an allergist.
An anaphylaxis meaning an allergic reaction.
Yeah, an allergic reaction, yes.
And so on that note, we have a question. Does one vaccine versus another have a higher rate of anaphylaxis or allergic reaction, particularly related to the difficulty of breathing, perhaps asthma or other issues?
That's a good question, and I don't think we know. The first reports of the anaphylaxis or severe allergic reactions were with the Pfizer vaccine, but then there were reports with the Moderna vaccine as well. I don't think we've given it enough Johnson & Johnson to really know if it's a different rate, and I think in overall the initial reports that it hasn't materialized as commonly as we were fearing that it was at the beginning.
Got it. Thank you.
And just to put a footnote on that, I think that's also part of the reason for people who've had a history of anaphylaxis. That's one of the questions that gets asked when you come in to sort of register to get your vaccine, and those people are watched for a longer period of time. Once they've gotten their shot, they're at the location where they receive it to sort of monitor them for any sort of reactions like that.
So another question from the audience. What if you've already had COVID? Can you expect worse negative side effects? Do you need the vaccine at all? That's open to anyone who'd like to respond.
I can respond a little bit. In terms of do you need it, we think that the natural immunity, when you get infected, the chance that you're not going to get infected again, you're protected for a couple of months. It seems like it's not, though, necessarily long-standing. The next year you might not be protected from it. And so the recommendation is that people who had an infection, that they get vaccinated, because the vaccine seems to produce longer and stronger protection against reinfection and against reinfection with other variants of the virus. So, when the virus replicates, it changes a little bit, and you can get reinfected with a little bit changed virus that the vaccine seems to protect against more. In terms of the side effects with having had it, I don't know, maybe Dr. Cruz can mention about her patients, but I think that it's not as, it doesn't necessarily give you a worse, reaction after having it or not.
Yeah, I think most of my patients, like, they haven't reported something different based upon whether they've had it or not. There have been, whether they've previously had COVID in the past or not, there have been some reports of people maybe having a little bit more of that after that second dose that I talked about earlier, having maybe a little bit more of that fever, the tiredness, if they had previously had COVID. infection, but nothing so, I think, so severe that anyone's having to be hospitalized or anything like that. And to Dr. Keet's point about the recommendation about being vaccinated, again, I have a patient, one of my dialysis patients who I saw just this morning who has had COVID twice, and I still recommended to them that they get the vaccine, which they did, this morning. And so, so yeah, that's definitely the recommendation. But that it's also though recommended that if you've had COVID before, that you wait at least 90 days from when you had the infection before you get the vaccine.
Thank you for bringing that point to our attention.
Someone
Dr.
asked
Keet?
how long the vaccination provides immunity, and I think
Yes.
we don't really know yet because it hasn't been so long that we've had it. We know it provides protection for at least 6 months, probably at least 6 months. But I think that we'll have to to have more studies over time to know whether you're going to have to get another booster shot in a year or things like that. But at least for the sort of near long term, it provides immunity.
So another question that we have in the chat, and I might not be getting this exactly right, but is getting the COVID-19 vaccination a requirement? Do you need any kind of doctor's note prior to receiving a vaccination? Perhaps you could answer both of those.
So I don't know that, I think that, can you hear me okay?
Yes.
Yeah. I think that, like Dr. Cruz had mentioned earlier, it's pretty much honor system when you go to register in terms of meeting the eligibility criteria. They're not going to ask you to bring a note with your diagnoses or prove that you're on certain medications if you're in the priority groups. I think the priority groups are obviously, taking under consideration the Centers for Disease Control and Prevention guidance and just general guidance about, starting with the most vulnerable and then expanding. So from the standpoint of being eligible for a vaccine, no one's going to require proof that you're in the eligibility group, as I understand it. To the question about is anyone required to, I can make the analogy for us as healthcare professionals to the flu shot. Over time, the requirements or the level of encouragement for people working in healthcare systems to get their flu shot has increased. In this instance, even for healthcare professionals who were sort of among the first people to have access to the vaccine based on the priority groups, given where we are in the approvals of the vaccine and how new it is, there was encouragement, but not a requirement. I'm not aware personally that there are any groups that are required to get the vaccine. I think part of that also has to do with the fact that these vaccines are approved for emergency use, with a strong safety profile based on what we know, but given the rapid timeline in which things have been rolled out, it's highly encouraged. And I think just to, this is one of those instances where our own actions contribute to the overall health of the population. And so the idea that the more people who are eligible to safely receive the vaccine who get it over time, the higher the likelihood is that the whole community, the whole population is protected against COVID. But I'm not aware that there are requirements for groups to get vaccinated at this point.
A couple other questions we received during the registration process. And again, any of you can feel free to chime in. Can the vaccine cause your blood pressure to elevate? Are there certain foods you should or should not eat after receiving either the first or second dose? And any recommendations around whether or not someone should take something like a Tylenol or Advil prior to receiving the vaccine?
Maybe I'll take the blood pressure one.
Please, go ahead.
So as far as the reports of blood pressure going up, that hasn't been a predominant kind of thing that has been noted as far as people's blood pressure rising actually, if anything, there would be perhaps a concern that blood pressure may fall, actually. And that's in the case if someone does have one of these types of severe allergic reactions. Actually, if anything, their blood pressure actually may fall. And so I'm kind of in the setting of like when people feel faint, their blood pressure is often low. And so no to that. As far as foods to eat, no, there's no recommendation around like types of foods to eat before or after. I think people should plan to eat as they typically would on those days. And then I think there was a question about taking like Advil or Tylenol. So there has been some, and I'd be interested to hear what Dr. Keet thinks about this in particular, but so I've read some about, recommending not taking these sort of anti-inflammatory type medicines like an Advil, Motrin, ibuprofen before getting the vaccine, because those reduce some of the response that we might get, when our body is producing an immune response. That being said, I have on the back end of actually receiving the vaccine, have certainly not heard anyone being discouraged about taking those kind of medicines should they develop a fever after they receive the vaccine, or should they have body aches in the hours after they've received the vaccine. But I'll turn to Dr. Keet on the.
Yeah, hopefully you can hear me. I think
Yeah.
there's a theory that it might interfere, but I think these vaccines do produce a really strong immune response. And I think it's probably not going to matter. I don't know that it's going to help very much to take more.
You're breaking up a little bit.
Hours afterwards that I really, sorry, can you hear me now?
Yes.
I'm so sorry. I think it's more like 12 hours afterwards that symptoms start really starting. So I'm not sure it's going to help to take it before, but I say go for it with the ibuprofen or Tylenol if you need it. I wouldn't worry about it.
Thank you. Dr. Thornton, could you perhaps speak a little bit about either what steps the state or localities or even health providers are taking to ensure vaccine equity?
Yes, absolutely. And maybe Dr. Cruz and I could tag team this
Absolutely.
one a little bit. So I will say that I know that thanks to the tremendous work of advocates and community leaders and a long history of our predecessors in the academic world, we were very well positioned to rapidly shine a light on all of the instances during this pandemic where there was likely to be some concern about justice and equity in terms of getting access to testing, getting access to appropriate diagnosis and treatment, and certainly that continues with getting access to vaccines. As I understand it, the local health departments and the state health departments are also very attuned to the fact that this is an ongoing area of concern and requires attention. And so I think there are a variety of ways that the state is trying to track information about those receiving the vaccine. And I think that that's also happening nationally. I'll just say that when you get your shot, I don't know if this was Ms. James's experience, but you will also, in addition to kind of sitting and being observed for a period of time, you'll also should be given some information about, with a QR code, about how to register and provide feedback about your own vaccine experience to the Centers for Disease Control and Prevention. And I would really encourage everyone to engage in that process because it gives an opportunity to report information about your own background, your gender, your racial, ethnic makeup, and also to provide feedback about your own experience and symptoms with the vaccine. And having good information about who is and isn't getting vaccinated, I think really helps to retool the approaches. I know that across the state, there has been interest in kind of geographic approaches and getting to folks who maybe have a variety of limitations and difficulties in reaching the mass vaccination sites. Examples being going into senior housing to really get to people who have limited mobility, who are very frail and aged. And I think there have also been, there's a real clear understanding that we need to get it to the people, that not everyone is going to be able to surmount all of the barriers of getting to these large, unfamiliar places. So I know that at a variety of levels, there's really a focus on trying to get closer to communities, either by partnering in the local community with community organizations or doing mobile vaccines. I will also say even the registration process, and I really commend BRHP for paying attention to this on our time today. You know, a lot of the registration processes rely on your access to apps or technology or smartphones. And so I think there have been efforts to try and have more phone lines available for people who don't have that tech savvy, you know, ability. I'm not sure that applies to this audience so much, but definitely has been a consideration with some of our elders. You know, but I think this is an area where there is a lot of room for improvement, frankly. And I frankly think that, you know, even the push to move beyond health departments, both local and state, and mass vaccination sites to really get to community pharmacies where, you know, I think in the coming months, there really is going to be a push to get to the local pharmacy in everyone's neighborhood as much as possible, because we know people like to get vaccines at those sites. And the state is also ramping up efforts to get to some of the clinics around the state, some of the federally qualified health centers and otherwise. So it is really important, if you have a doctor that you have a really good relationship, or a clinic that you're very familiar with, that's another local resource to ask them where they are in the process of having access to providing vaccines as well. So, you know, certainly the same kind of disparities that we've seen otherwise have reared their ugly head again with how people have gotten access. But attention is constantly being shown on this issue. And I think that some of the strategies coming down the pipe will hopefully make things more accessible. And events like this just make it clearer to folks about, you know, get questions answered, get prepared, understand what the process is going to be like. But I would love for Dr. Cruz to chime in, because I think I meandered a little bit there in my response.
No, I agree with everything you said. I think one thing I would just kind of add to that, and just to mention, is that what we've seen is that because, you know, these vaccines are really largely regarded as being quite safe and effective, people really want them. And we've been seeing in some communities where people who don't live in those communities, maybe some communities maybe that are not as wealthy, for example, maybe not as advantaged, they've been having people from more wealthy communities, even other states, to come in and try to access vaccines there. And so in addition to what Dr. Thornton was saying in terms of looking at, you know, where there are opportunities for us to be better about making sure that the people who need the vaccine the most are getting them. There's also a real focus on making sure that in certain areas that the people who live there are being prioritized for the vaccines that are available in those communities. I live in Prince George's County, which, as you all may know, is a predominantly, in terms of its residents, predominantly African American and also Hispanic community in terms of the county here. And what we had seen in this county, is well documented, is that there were people coming from other counties that were accessing the vaccine here. And the vaccine rate in Prince George's County has not been as high as it has been in a number of other counties, despite the death rate from COVID being pretty high. And so, so there's a lot of real focus and attention now on really trying to uncover what's going on there, and to try to do things to prevent, you know, further kind of disadvantaging people in this regard. So just continued work that's ongoing in this area.
Absolutely. And vaccine equity obviously is at the forefront of BRHP's mind. And given the population that we serve, our goal is to try to make this information as accessible as possible. We had an earlier question that I skipped, and it's optional for our panelists to answer. I will start, but the question was to the panelists: have you all been vaccinated? I have had my first dose of the vaccine. I'm scheduled to get my next one in mid-April. Would anyone else who's on the panel like to share?
Yeah, I've had both of my doses. I'm more than a month out from having both of my doses.
Same here.
And Dr. Keet
And I made
says,
sure I got my mom to her vaccine appointment too. So I think also for those elders and those folks who may need a helping hand to overcome some of the barriers, to just be a champion for those people in your lives too.
good reminder, absolutely. Dr. Keet also mentioned she was fully vaccinated in January, and her husband is getting vaccinated this week. Wonderful. So after someone is fully vaccinated, do we still need to adhere to the COVID-19 safety practices, such as wearing a mask, the physical distancing, steering clear from large gatherings? What are your thoughts on that? Dr. Thornton, I saw you nodding.
So I'll say yes, and it was well timed because I think Mr. Berkowitz put a similar question in the chat. So, you know, I might let Dr. Cruz speak to some of the more nuanced guidance when you're talking about small groups of people who are all fully vaccinated. But I can tell you, it does not change my interaction with the world. The last I heard, sort of in the you know, credible reports from the public health experts, I think as a nation, we're somewhere in the realm of 15% of the population having had one or both doses, and maybe a bit higher in our state, but nowhere close to that level of 70% or higher of fully vaccinated population. My husband has not had access to the vaccine yet. I'm crossing my fingers every day now that he can get in, now that he's in the 2B group, and definitely I want to protect him. And so, you know, we really haven't even changed our in-home interactions with others who we know may be vaccinated until he's fully protected. And certainly in the world, when we're going to the grocery store or when we're making decisions about where we spend our time, it's still really strongly advised to continue the mask wearing, to continue maintaining our distance, because there are so many people who may not yet be vaccinated. And because under any circumstances at this point, we don't want to increase transmission. I think Dr. Keet had made the point earlier that every time the virus gets transmitted, it has an opportunity to change and become more nimble and more able to evade either treatments or our immune responses from vaccine. So in general, like in the world overall, I think largely the recommendations are to keep doing the practices that we've all become quite familiar with, that are, you know, taxing at times, but help keep us safe. And I don't know if Dr. Cruz, maybe you want to take the other part of the question, which is sort of around small gatherings with people who are fully vaccinated within your community, your internal community, your family.
Yeah. Thank you. Yeah, happy to. So, and I'm fortunate. My husband is also fully vaccinated, and so in terms of what we, you know, have been able to do, I think around other fully vaccinated people, I enjoy playing tennis, and I have a group of friends that I play with on Monday nights. All of them are also fully vaccinated, and so so that's that is a group as well that I we spend time with. We actually those still tend to wear our masks for most of the time that we're together, except for when we're quite sort of separated on the tennis court. But in general, as Dr. Thornton was saying, we still all, my husband and I, and the rest of my family, still all practice when we're out in public, still wearing masks, still sort of physically distancing ourselves. And so yeah, I think not much has changed. I think one thing that's important to know is more information is coming out about this, but we still don't know if people who are vaccinated can get the virus. We know that it looks like they don't get sick. It's certainly not sick enough to have to be hospitalized or have to be or to die from COVID infection. We don't yet know fully whether they can actually have COVID infection without symptoms. And so given that, even for people who are vaccinated, we still do need to kind of keep those things in mind, especially when interacting with people who are not vaccinated. So we still should be practicing the same measures that we have been for this
I
very.
will say the one thing in this regard that my mother has definitely been looking forward to is being able to spend time once fully vaccinated with her grandchildren without masks on. And that is something, you know, I think it's still really important to take the care, but the public health, you know, guidance does say that, you know, once fully vaccinated, and that's that 2-week period after your second dose or after completing your vaccine series, you know, at that point, you know, grandparents can see their grandchildren face to face, which I think, you know, for some of the parents on the line or grandparents or otherwise, are, you know, is a game changer at this point in what everyone has been through. But again, like Dr. Cruz said, I think it's really in those small groups with your internal family community where you know what people are doing, where you know their vaccine status, and you are keeping that in mind. And in the world, otherwise, we have to continue to be safe.
So I'm going to take the last question. Is there a need, so to the extent you've been vaccinated, perhaps we're 2 months from that time period, maybe 4 months from that time period, you know that you have been exposed to someone who tested positive for COVID-19, or you start to experience symptoms, should the testing practice remain in place as well?
100%. Any symptoms that are concerning for COVID, any close exposures with a single symptom, depending on which algorithm you're following, absolutely 100%, all of those people still need to be tested. We cannot let our guard down on testing because, again, there's still so many who are vulnerable. And every time the virus transmits, there's that risk that it can develop a way to get around the vaccines and the treatments we have. So definitely keep that in mind. You know, I think it's, at this point, a lot of healthcare facilities are very clear on how to get people tested in relatively short order. You can even do video visits in a lot of instances and get access to testing after seeing someone remotely. So 100%, that's still really, really important to do.
Agree.
All righty. Well, I want to thank our experts for joining us for this roundtable discussion. We, again, are going to be providing the information via recording and in the form of a PDF fact sheet to those of you who attended. Thank you so much to our audience for joining us. I hope that you found this very helpful. We will continue to bring you important information, important updates such as these. So please, if you're not subscribed to our newsletter, please check out our website, brhp.org, and subscribe. And additionally, watch your email inbox for updates from us. Thank you, Dr. Thornton. Thank you, Dr. Cruz. Thank you, Dr. Keet. Thank you, Tish James. And thank you all for spending your hour with us. Have a wonderful evening.